So I'm going to be working with patient 2 today. It's the 62-year-old that had a wrist fracture surgery 3 months ago, and he just has some decreased range of motion and he's feeling some pain. He also had his cast removed. So we're going to be doing some deep friction and relaxed passive movements today. Before we get started, I understand he has no lacerations or any bruising in the areas. He also has no open areas that I can see at the moment in the area. He has no gross edema as well, so we don't have to worry about splitting of the skin. And he also has no cancer in the area as well, so it's okay to get started with these techniques. So he is complaining of some decreased range of motion in his wrist area, so I'm going to be doing some deep friction and by the area of the incision. So this incision was over here, so there's a lot of scar tissue in this area. We're going to be doing some transverse friction just to kind of break up that scar tissue a little bit and jumpstart the inflammatory process. So what I have him doing is I have him seated position, and I have his arm extended just like this and his wrist extended. So he's going to hold this position like this just so we can get a little bit of stretch when we're doing it. And I'm just going to be working on my target tissue, which is the scar tissue over here. And we're going to just do some transverse friction over here. I have no medium. I'm just doing directly on the skin. And indication to do this technique is if he has any chronic superficial scar tissue built up. This could be causing some of the restriction in his wrist range of motion. So I'm just going to be doing this a little bit. And my rationale for doing this is it's going to jumpstart the inflammatory process by breaking up a lot of that scar tissue. And by starting up the inflammatory process, it's going to promote some vasodilation, allowing a lot of those healing factors to come in, just so it could start healing that tissue again and make sure that tissue is healing in the correct direction, those collagen fibers, just so it's not causing any of that restriction with wrist flexion or extension. So I'm going to be doing this for a little bit. And like I said, he's in, it's chronic scarring, so this is okay to do it on the area. Okay. So after doing that for a little bit, we're going to do some relaxed passive movements. So indication to do this is prolonged immobility. So he's been in a cast for a while, so this would be appropriate to do this. So what I'm going to do is I'm going to keep him in that same position, and then I'm just going to go into flexion here, apply a little bit of overpressure, and then go over here. Little bit of overpressure. So we're going to be doing this 4 to 5 times. My target tissue is the wrist joint itself and the connective tissue around it. So in the long term, we're trying to regain some of that functional range of motion. What this technique is doing is similar to a passive range of motion, where it's breaking up some of those adhesions, allowing some of that synovial fluid to lubricate the joint, and just a little bit of pain relief, but not so much, just because we're not doing it for so long. But since we are applying a little bit of overpressure and distraction, it's also reminding those connective tissues and soft tissues about their elastic properties, and just reminding the tissue how they're supposed to move. So I'm just doing 4 to 5 times in each direction, and then that will be all.